I'm joined now by Dr. John Jeffries. He's professor of cardiology at UT Health Science Center. He also leads the new Methodist Institute for Cardiovascular Science. Dr. Jeffries, good morning. How are you?
Good morning. Thank you for having me.
I appreciate you being here. What is cardiac arrest? A lot of people think it's a heart attack, but that's not necessarily the case. Can you explain it to us in layman's terms?
Sure. So, what happened here is that the heart stopped beating essentially, and that can be from a variety of different reasons. But what we probably saw here was not a classic heart attack, which is more of a blockage in the coronary arteries typically. This was likely more from a rhythm disturbance, which could have a variety of different mechanisms or causes. And I think those still need to be, worked out and disclosed by the healthcare providers there. But the important thing here is that CPR was initiated and the defibrillator was used to resuscitate him successfully, as you heard twice. This was required. And I think that's the big takeaway, is really people understanding the importance of CPR, the awareness of using defibrillators or what are called AEDs, which are available usually in public forums to help save people's lives. And that's really what happened here, is a rapid institution of CPR made a huge difference.
Yeah, it's interesting because one of those things is I saw the play. I was watching the game live, and when I saw the play, it looked like anything, a very routine tackle. Didn't look like anything super severe or super strong or super combative. It was just a routine tackle, and then he went into cardiac arrest. How do you explain that in medical terms of why something so routine had this devastating effect?
Yeah, we'll need more information to fully understand exactly, probably mechanistically, what was going on here. But we do know there are conditions where pressure to the chest wall, it's a condition called Commotio cordis, can actually lead to unusual heart rhythms, which can be fatal. And so essentially this is the heart having a pressure applied to it, and which could happen in football or any other sport actually. And it essentially disrupts the normal heart rhythm. So if it's timed perfectly on the way that the heart rhythm tracing is occurring, it can induce a thing called ventricular fibrillation, which is essentially the heart not beating. It's fibrillating or squeezing at a really rapid pace, but means there's no real blood flow going out to the body. And that's where the use of a thing like a defibrillator would be very helpful. And then during that time period between when that fibrillation occurs and when you can apply the defibrillator is when CPR is hugely important and is an essential to a successful resuscitation and restoration of normal circulation. So it's hard to know exactly for sure what happened because we just don't have enough information, but that's absolutely a possibility. There are other types of heart diseases that could lead to something like this. There's a condition called hypertrophic cardiomyopathy that sometimes we see in athletes. And that's information that can be obtained, through imaging of the heart, like an ultrasound or an echocardiogram. So all of that information will still need to come to us, but this idea of this hit to the chest that can induce a bad heart rhythm has been a known entity for many years. And we do see it more commonly in younger athletes and young males. Interestingly, similar, in the sex predilection here we see in a male, but it's usually around 15 years of age or so. But it can occur in other ages, and it can occur in other sports. So I think the awareness of this is hugely important, and understanding that things do occur in sports that can be unanticipated. As you've heard from many of the NFL players, they're used to seeing joint injuries and orthopedic injuries, but something like cardiac is not as common, but obviously hugely impactful. And what can we do to help when these things do occur to be best prepared? And I think that's where CPR and having availability of defibrillators is hugely important.
Yeah, we've Many stories about the need and the necessity to have AEDs in various public areas. I know the church that I attend, we have a couple of AEDs set up in different areas where people congregate. The need for it. I'm curious, though. Here is a 24-year-old in top peak physical condition, and he has this cardiac arrest, and I've heard the term that you mentioned, Commotio cordis, but I understand it is extremely rare. And forgive me for saying this, but I'm a huge football fan. I've never seen anything like this happen ever, where a game is stopped because someone's heart is stopped on the field during the play. So I'm just curious, I mean, if we're listing some of the reasons why this happened, and again, we don't know because we don't have all the information, but where does that list, start with the most probable sense, and where do we go from there?
Yeah, I think, based on, as you said, we don't have all the information. Based on what we know, this probably was a primary cardiac issue. So when people have an arrest, it can be from different things. It's not just your heart always. Sometimes it could be a lung issue or other things that are more systemic from the pathophysiologic perspective. But based on what we're seeing, the abruptness, the need for a defibrillator would typically indicate this is probably cardiac in origin. And then you start thinking about, as you said, young guy, healthy, obviously very fit person. What are the things that could happen? We do know there could have been underlying circumstances that were there. As I said, maybe a cardiomyopathy or something. Be very atypical for those sorts of things to be there because of the screening processes that these players go through. But they can have very subtle changes sometimes that aren't always detected. So that is a possibility. But I think the more likelihood, based on what we saw on video and knowing that this can occur in young athletes, that the commotio cordis may be the most likely possibility. As I said, to have more information would give us a lot more opportunity to best understand and to tag what the cause was. But this is a hard thing to understand. If you think about it, someone playing football, they don't have a heart monitor on when they're playing typically. So the idea of being able to look at the heart rhythm at the time of the impact and then subsequent to that is not available to us. So the only time we're going to have any heart rhythm data is when they put that defibrillator on and we were actually able to see what the rhythm looked like. So the time from the actual impact until the time of the defibrillator is sort of going to be an unknown from a rhythm perspective. So to say definitively that's exactly what happened, part of this is really going to always be a little bit of an unknown consideration because we just don't have the data to accurately document exactly what happened. But I think based on, a young, healthy person, it does make it a likely possibility that commotio cordis was what happened here. I'm sure that extensive testing has been done at the University of Cincinnati, excellent healthcare system. I'm sure they're doing everything to best define exactly if there was any underlying cardiovascular pathophysiology that was there prior maybe. And then more importantly, what do we do moving forward to keep him safe, right? So get him through this to the best of their ability. And then how do we protect him long term? And part of that's really understanding about what happened. So that'll be through extensive testing and other things. But once again, let's say it was commotio cordis, let's say it was cardiomyopathy, like a hypertrophic cardiomyopathy. The sudden death phenomenon is a common pathway for all of those diagnoses. And that's where really coming back to not necessarily knowing exactly what he had, but we know what the end result was. And that was a cardiac arrest, is knowing what we need to do. And that really is back to rapid response. For bystander CPR, unfortunately, occurs in less than half of the cases that occur in the United States. And this is cardiac arrest is a common phenomenon, not in this age group, obviously, but about 350,000 cardiac arrests occur each year. So understanding if that's in a public forum, it's important for people to get involved and to initiate 911, to initiate CPR, to look around for the AED, as you were alluding to at your church. All those things are hugely important because that's ultimately what was able to gain back circulatory sort of flow in this young man, and able to get him to the hospital where he could get adequate care. So, this is such a bad situation. And I think it really comes back to increasing awareness, is that cardiovascular disease kills more people in the United States than anything else. And what can we do to help mitigate that? How can we improve outcomes? And CPR and defibrillators are absolutely a vehicle to do that.
Let me ask you about markers here, because a lot of people are wondering what kind of preventative steps could have stopped this event before happening. I mean, a lot of people are just wondering, would there have been tests to give, just kind of an alert or something that says, hey, there's an issue here and it needs to be addressed immediately?
It's a great question. I think these players, obviously high school, college, professional athletes go through screenings and physical exams, and so extensive testing is done. So, that's having the sort of pre-existing heart disease comes as a lesser likely possibility here. If it really was commotio cordis, and as I said, that's really a hard thing to diagnose in a retrospective sort of fashion, but based on the information that we have, if that's really what was going on, there really aren't any preventive strategies that can occur. Even people that wear chest protectors, and so this is seen in other sports, as I said, things like soccer and whatnot. People that wear chest protectors, that still doesn't always protect you from a cardiac arrest secondary to commotio cordis. So this was really just a bad timing event, and it is exceedingly rare. If you think about, we're talking about a very exact hit during the cardiac cycle when the heart rhythm is going. It has to be very precise, and it has to be in a certain spot, typically on the chest. So for that to occur is very, very rare. But once again, I don't think there's anything that we could have done preemptively if that were the cause here to avoid this. It's one of those things that it may happen in any situation, and you have to be prepared to deal with the consequence of commotio cordis, right, and that ventricular fibrillation. And that's where learning CPR and having access to defibrillators is very important. And remember, this is a very rare phenomenon. Things like heart attacks are very common, right? And we see that very commonly in the Mid-South. And it's going to be the same application: 911, CPR, defibrillator if appropriate, right? And I think those are all of the things that really bring us back to the importance of people just understanding how to react in these situations. Watching it at home, I've seen this in real life, real time at sports events, and it's surreal. It's so unusual, and and people are looking around. Someone falls to the ground unexpectedly, and you really don't know what to think initially. It's like, wow, I wonder what's going on. Did he pass out? Did he hurt his leg? Something, and it's almost like time freezes a little bit. And you have to be aware of what's going on and really institute the appropriate measures, because about 90% of people that experience an out-of-hospital cardiac arrest, which is what happened here, do not make it. And that is absolutely tragic. And what can we do to make a difference in that situation? So I think there'll always be people looking back at these situations, and appropriately so, to say, is there anything else that we could have done? But I don't think, if this was really commotio cordis, that there was probably anything preemptively that could have been done. It's really about the reaction to what happened. And the teams there really did a great job at stepping onto the field, knowing what was going on and intervening quickly. But I think it just comes back to doing appropriate screenings if you're going to play sports, right? If your family are going to play sports, make sure you go through the right steps to do as much as you can to ensure safety. And then during sports, things happen. And as we said, oftentimes that's more of an orthopedic sort of a thing, or maybe head trauma and whatnot, but cardiac is still a part of the consideration. And making sure that we're prepared to deal with that, I think, has to be an important step for us moving forward as a community.
Sure. So, Dr. Jeffries, one final question. He had to be revived 2 different times on the field there. What does that tell you about the severity of what happened, and why was that the case?
Yeah, it's hard to know exactly about what was going on, without looking at the data. But this rhythm we're talking about, ventricular fibrillation, is a very unstable heart rhythm, and so it can come and go. And you have to remember they were resuscitating him, and during that time period, there's no real, there's very limited circulation to the body, right, except for what we're accomplishing with CPR. And when you resuscitate someone, the heart starts getting oxygen again, and sometimes it can still be a little bit irritable, right? And that's probably what happened here, is that he was shocked, hopefully returned into a thing called sinus rhythm, but then the heart is still in a very unstable situation. It's very irritated, and for whatever reason, it can flip back into these unstable heart rhythms, something like ventricular fibrillation. And if that happened, remember, that's essentially no blood flow to the body. And so you have to reinstitute the CPR, and then you want to shock again, because that would be an appropriate rhythm to defibrillate. And that's probably what happened, is that had an unusual heart rhythm or a pathologic heart rhythm like ventricular fibrillation, shock, probably got back into some sort of a relatively stable heart rhythm. Heart was still irritable, went back into an unstable heart rhythm, something like a ventricular tachycardia or ventricular fibrillation, which required a second defibrillation. But those are the appropriate things to do, and that's exactly what these devices do, is that they help understand what the heart rhythm is, if it's appropriate to shock for that heart rhythm, because remember, we don't want to shock all the time. Some heart rhythms actually don't respond well to being shocked. And then they deliver the shock, and then they'll tell you if the appropriate heart rhythm has been restored, or maybe you need to shock again. And so the team there did a tremendous job, and now it's just a waiting game. We hope that during the resuscitation the perfusion was good, and that hopefully all of his end organ function and all those things are going to be good walking out of this situation. But that's one of those things that time will tell ultimately. But I think, once again, encourage everyone to learn about CPR. The American Heart Association has mechanisms to do that, and please do that, because this could happen anywhere, anytime. Be clear, this is not just something that's unique to the NFL.
Sure. Why don't we end with that, Doctor? Can you give us maybe a place someone could go if they're watching this where they can sign up and learn CPR?
Absolutely. So the American Heart Association has, you can go on the web. It's heart.org/CPR. There are other mechanisms to learn CPR, as you were alluding to. Your church, your community outreach oftentimes will do CPR. But I would just encourage everyone, and if you need help, please reach out to the American Heart Association. They can absolutely facilitate that. It's an easy skill to learn, and it saves lives. It's just that simple. It saves lives, and I hope we can teach not only our adult community, but our young people in the community as well, because they're going to be at these sporting events too, to learn the basics of CPR, because it really is a game changer, and it saved this young man's life.
No question about it. Dr. John Jeffries, appreciate you, UT Health Science Center, and you lead the new Methodist Institute for Cardiovascular Science. We appreciate the deep dive into this topic about what happened at Monday Night Football and ways to really get the word out and help others with AEDs and CPR training. Thanks very much.
Thank you for your time.